seated. And now, please welcome the 𝗟𝗂𝗪𝗚 Dance Company of Consolacion for the opening salvo.
I love Cebu. I love Cebu. Ang kaanindot mo, ang mga tao wag gid kay ikareklamo. Bisag asa ko paingon way buwas ang pagdaig ko. Magpabilin ka ning dughan ko. I love Cebu. Kalipay ko, bisag asa ko paingon ni panghambog yun ka. Bisag asa ko paingon way puwas ang pagdaig ko. Magpabilin ka ning dughan ko. I love Cebu.
Di jud ka maguol, buot ang mga tao ang nuduol. Busa, asa pa ka, Cebu na ta, o higala manuroy ta. Bisag asa, dali na, tara na.
Bahandi ka ning dughan ko. I love Cebu. Isingit ko ning kalibutan. I love Cebu.
Thank you, 𝗟𝗂𝗪𝗚 Dance Company of Consolacion, for that wonderful performance. And now, everyone, please welcome your host, Miss Zaggy Gonzalez and Mr. 𝗟𝗂𝗫𝗀𝗀𝗀𝗆. A round of applause, please.
All right, good morning. Wow, what an amazing performance that was from the 𝗟𝗂𝗪𝗚 Dance Company of Consolacion. Thank you as well to Mr. Fritz Justin Sagang for that soulful rendition of Goodness of God. So magandang buhay. Good morning, ladies and gentlemen, and welcome to the launching of the Proteksyon para sa Altapresyon program.
That's right. Welcome everyone and good morning once again. Maayong buntag. As the sun is up and rising over Cebu City, so is our commitment to beating hypertension and maintaining a healthy lifestyle. Welcome everybody to the Proteksyon para sa Altapresyon launching program. Good morning as well to my cordial co-host. Kamusta, James?
Good morning, Zag. Fine as well. Thank you very much for asking. So a very meaningful activity that we have for this morning.
Absolutely.
For those who can't be with us here physically at Sarrosa International Hotel, we are live in our Department of Health Central Visayas Center for Health Development official Facebook page. So you may also join us via Facebook Live.
All right. Thank you for that information, Jabe. To commence this program for today, we would like to call on the OIC Chief of the Local Health Support Division to formally welcome everyone. Please help me welcome Dr. 𝗟𝗂𝗘𝗍𝗍𝗆. A round of applause, please.
Thank you, Zaj. So again, maayong buntag sa tanan. Good morning. On behalf of the Department of Health, Central Visayas Center for Health Development, it is my distinct honor and privilege to warmly welcome you all to the official launch of the Proteksyon para sa Altapresyon program in Central Visayas. Today's gathering demonstrates our collective commitment to protect every Filipino, every Cebuanon, every Boholano from one of the country's leading cause of illness and premature death, hypertension or taas ang BP. More importantly, it reflects our shared belief that healthier communities built through strong partnerships make programs work. But before I move on, allow me to recognize our distinguished guest for today. We are deeply honored by the presence of our Director from the Disease Prevention and Control Bureau, Director Adrian Sobaan. Doc, thank you for flying in all the way from Manila. And also Ms. Rosemary Holandes, our Supervising Health Program Officer of the Disease Prevention and Control Bureau. Ma'am, welcome to Cebu. Also, we have later on coming in our officer in charge from the Office of the Assistant Regional Director, Dr. Jonathan Neil Erasmo. And of course, our colleagues from the Cebu Provincial DOH Office with Engineer Gerson here and also Sir Rolly coming in later on. And our esteemed partners from the World Health Organization, Dr. Yun Yung Ko, apologies, Doc, our WHO representative, who I was informed by Raj, has just been recently confirmed. Welcome, Dr. Ko, to the country and to Cebu. And of course, our technical representative from the WHO, Sir Raj. Though it's always a pleasure to welcome you here in Cebu, Sir Raj. And of course, our representatives from the Provincial Government of Cebu, Attorney 𝗟𝗏𝗏𝗍𝗍𝗆, Executive Assistant to the Office of the Governor. Attorney, welcome. And of course, Dr. 𝗟𝗂𝗍𝗍𝗆, our Provincial Health Officer too, our local health chief executives and representatives from the local government units of Cebu Province, Bohol Province, Cebu City, Lapu-Lapu City, and Mandawi City. And of course, our city and municipal health officers, public health nurses, midwives, and barangay health workers who are always our partners and colleagues in the department, and also our partners in pushing for programs that would benefit the greater part of our community. To everyone, maayong buntag and daghang salamat sa inyong presensya. I think all of us here who are working in our RHUs and primary care facilities have this conversation day in and day out. When we have people coming in, nagani makita nga magbitbit og sphygmomanometer, magdumog din ng mga tao magpa-BP. I think that's always what they assumed if you're a nurse, especially when you are a newly registered nurse. I remember that when I was a newly registered nurse. It always is the first task you do in your family, to check the BP of your family members. Diba? I think that's a rite of passage for any health workers. And I think it's also one of our first jobs that distinguish us from other workers in the community, checking the BP. And I think this is very timely because it's always is a conversation starter when people are surprised that their BP are elevated. They always dispute it. They always say nga, why is my BP elevated? Nga wala mo ko gibati. Or tungod na adok kay stress ko ron paguna sa bukid or pag-atiman sa akong makahayupan or tungod kay wala ko'y tulog. But it always is a conversation starter to change outlooks in terms of what this particular silent killer is in terms of their aspect in their life. It always reminds us that hypertension is called a silent killer not because it is impossible to prevent, but because it often gives us no warning until it is too late. Behind every uncontrolled blood pressure is a family that may lose a parent, a breadwinner who may no longer be able to work, or a grandparent who may never see their grandchildren grow up. The good news is that these stories and these conversations do not have to end in disasters. High blood pressure is one of the most preventable and manageable health conditions we face today. A simple blood pressure taking takes less than a minute, yet it can prevent years of disability and even save a life. But this responsibility does not belong to the Department of Health alone or even to the local government unit alone. It belongs to all of us, every community, every family. It also belongs to our governors, mayors, and barangay officials who need to invest in healthier communities. It also belongs to our local health boards that prioritizes non-communicable diseases programs compared to other usual glamorous programs in our public health armamentarium. It belongs to our city and municipal health officers who will ensure quality primary care and ensure quality and effective medications are available to all of those who need them. It belongs to our public health nurses, midwives, barangay health workers who go from house to house, sitio to sitio, barangay to barangay, to ensure that these people who are diagnosed take their maintenance medications and always return for follow-up. This also is something we always have to correct them. If okay na ang BP, I stop taking the meds because it might affect my kidney, but they will take on MX3, sorry for the plugging, or other supplemental medications because they assume that is safer compared to our medicines that we provide for them. And of course, it belongs to every family that chooses healthier foods, regular physical activity, and routine blood pressure monitoring. Busa ang proteksyon para sa altapresyon, di lamang usa ka programa, kini usa ka kalihukan, usa kini kapanawagan sa tibuok komunidad nga magtinabangay aron mapugnan ang sakit sa dili pa kini magsugod. This initiative embodies the spirit of universal health care, of bringing quality preventive care closer to where people live. It reinforces the strongest health system is not measured by the number of hospitals we build, but by the number of strokes, heart attacks, and kidney failures that we prevent. Today, we begin a stronger partnership among the Department of Health, our partner World Health Organization, our local government units, our healthcare workers, and our communities. Doc, Fashal, good morning. Together, let us ensure that every Filipino, every Cebuanon, and every Boholano knows their blood pressure and has access to quality treatment and receives the support needed to live a healthier and longer life. Sa atong panagiusa, mahimo natong mapugnan ang daghang kaso sa stroke, sakit sa kasing-kasing o kidney failure. Ang atong paningkamot karon mahimong kinabuhi nga maluwas ug ang pamilya magpabiling lig-on ug malipayon ugma ug sa mga umaabot nga adlaw. Once again, in behalf of our Regional Director, Director Joshua Brillantes, and the entire team of the Central Visayas Center for Health Development, I welcome you to the launch of the Proteksyon para sa Altapresyon program, and may today's launch inspire stronger partnerships, healthier communities, and a future where every Filipino, Cebuanon, and Boholano is protected from the silent threat of hypertension. Again, everyone, welcome ug maayong buntag sa tanan.
All right. Thank you very much, Dr. Baton, for that very inspiring welcome message. Thank you as well for acknowledging our guests. And as we can see, the DOH, or Department of Health, is tireless in its constant collaboration, coordination, as well as its efforts with different local government units, local health officials, and essential stakeholders. As Doc Baton mentioned, no, the responsibility is not just within the DOH, but falls within all of us.
All right, exactly, Jay. That is why this launching provides an opportunity for all partners and stakeholders in the lifestyle-related diseases unit and puts emphasis on the importance of awareness of high blood pressure and hypertension.
Exactly. So we acknowledge the unyielding commitment and exemplary contribution of our partners, stakeholders in pushing our LRD initiatives and efforts here in Central Visayas.
Okay, moving forward to provide insight, let's call on stage the NCD Technical Officer from the World Health Organization, Mr. 𝗟𝗂𝗁𝗇, to share us with the global situation. A round of applause, please.
Good morning, maayong buntag sa tanan. Distinguished guests, DOH colleagues from the central and regional level, provincial and local officials, our esteemed healthcare workers, thank you very much for inviting WHO Philippines to be part of this important gathering. So today, as we launch Proteksyon para sa Altapresyon here in Cebu Province, before we talk about what we are doing locally, please allow us to share and show you why this launch matters, not just for Cebu, but for our country and for our region. Sige lang, nag-loading pa daw. Sir, katong old na lang, Sir Clark. Okay na? Yeah, sige. There you go. So, apologies for that. So, we live in the Western Pacific region, home to some of the world's most diverse nations or member states. But this region also carries a heavy burden. This slide shows the probability of dying prematurely between the ages of 30 to 70 from the four major non-communicable diseases, namely cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. And look at where the Philippines stands, somewhere in the middle. Every dot on this graph represents thousands of lives. And while the Philippines has made important progress in health over the years, too many Filipinos are still dying prematurely from diseases that we know how to prevent and treat. And that is why today's launch is important. In 2015, the world committed to the Sustainable Development Goals. So SDG 3.4 calls for a 1/3 reduction in premature mortality from NCDs by 2030. And to note, we are 4 years away from that deadline. And the hard truth is, the majority of countries in our region are not on track. Whether you are a high-income country or a Pacific Island nation or a low and middle-income country, most of us are falling behind. Unless we accelerate the action on NCDs, particularly on hypertension, we will miss this target. So what is driving this burden? What is the single greatest risk factor for death and disability in our region? As mentioned by Dr. Baton earlier, it is hypertension, high blood pressure, or altapresyon. So globally, an estimated 1.4 billion people aged 30 to 79 are living with hypertension. Yet, fewer than 1 in 5 of them have it under control. And that is a staggering gap. Hypertension is responsible for more than 10 million deaths every year worldwide. And in our region, cardiovascular diseases, which hypertension directly drives, accounts for nearly half of all NCD deaths. And what makes this especially alarming is that hypertension is often silent. People usually feel perfectly healthy until suddenly they experience a stroke, heart attack, heart failure, or kidney disease. And by then, the opportunity for prevention may already have passed. As of 2019, the Western Pacific region has the greatest number of people living with hypertension of any WHO region in the world. And that's 346 million people in our region living with hypertension. And this number has been growing steadily since the 1990s. And please look at the cascade on the right. So of all those with hypertension in our region, only 19% have it under control. So imagine 10 people living with hypertension, but only about 2 to 3 have their blood pressure under control. And the other 8 remain at risk for strokes, heart attacks, and premature death. And that is the challenge we are here to change. So when we look at the diagnosis coverage by country, the picture becomes even clearer. As of 2025, WHO projects that only about 56% of people with hypertension in our region are even diagnosed. Nearly half remain undetected. And the Philippines sits in the middle of this ranking. Not the worst, but with significant room to improve. The encouraging news is that countries across our region have shown that high rates for detecting and diagnosing hypertension are achievable at the primary care. And this tells us that improvement is possible when screening becomes part of routine primary health care through PhilPen. Now, this slide illustrates a pattern we see across the globe. High-income countries tend to have lower prevalence but higher control of hypertension, while lower middle-income countries like the Philippines have higher prevalence and much lower control. And in the Philippines alone, about 33% of adults are hypertensive. Of the 16.8 million affected Filipinos, approximately 13.6 million do not have their condition controlled. The national control rate stands at only 19%, compared to 50% as the global benchmark, and 61% in our neighboring country, in the Republic of Korea. And this is the gap that we must close. And here is also another sobering reality. Over the past decades, health systems in the Western Pacific have made tremendous progress against infectious diseases. Coverage has climbed significantly. But NCD services, relatively little change. Our health system was built and are still largely oriented around responding to acute illnesses and infection, while for chronic long-term continuous care that conditions like hypertension require, the system is not yet fully there. And this is the structural challenge that we must address. And this is exactly why WHO promotes strengthening primary health care, not simply treating disease when complications occur, but preventing them before this happen, or before they happen. And NCDs and hypertension are not only health issues, they are also economic issues. Uncontrolled hypertension leads to decreased productivity, increased healthcare costs, and a greater societal burden of caring those who survive heart attacks and strokes. The economic analysis is clear. Investing in hypertension control is not only good for health, but it is also good for our economy. Preventing strokes and heart attacks reduces hospital admissions, lowers our healthcare costs, keeps people productive, and protects our families from catastrophic expenses. And there are only few public health investments which offer such substantial returns. But beyond economics, let us also not forget the human cost. Hypertension strikes people in their prime working years. A stroke at 45, a heart attack at 52, and these are not just personal tragedies. They can push entire families into poverty, medical bills, lost income, long-term care, and the ripple effects are profound. And this is why early detection and sustained control matters so deeply. And the good news is, many of these risk factors are modifiable. Healthier diets with less salt, regular physical activity, avoiding tobacco, reducing harmful alcohol use, and cleaner environments all contribute to healthier blood pressure. These are actions governments, communities, and individuals can all take together. Simple changes in what we eat, how we move, and what we are exposed to can make a real difference. So WHO has developed the 𝗟𝗂𝗏 technical package, which is a practical, evidence-based set of strategies that can be implemented right at the primary care level. The 𝗟𝗂𝗏 package translates our global evidence into practical actions inside our health centers. It provides our healthcare workers with simple, standardized approaches that improve the quality and consistency of hypertension prevention and care. And this is not a theory. It is a proven framework that works, and it is the foundation of the program that we are launching today. So since 2016, approximately around 40 countries have adopted the 𝗟𝗏𝗏 package to strengthen CVD management at the primary care level. But today, I am especially proud to say that Philippines is not just adopting 𝗟𝗏𝗏s, but we are helping demonstrate how it works. Through the Healthy Hearts program in Western Visayas, we have shown that excellent hypertension control is possible even in resource-constrained settings. In our mature implementation sites in Iloilo province, 86% of our patients enrolled in care have achieved blood pressure control. And today, Cebu province becomes part of that growing movement. We are no longer asking whether hypertension can be controlled. We have already shown that it can. And the question now is, how quickly can we bring this success to every municipality and every Cebuano? But what made that success possible? So it begins with changing how we think about health. So in the past, we often viewed health as simply the absence of disease. You were either sick or either healthy. And today, we understand that health exists in a continuum influenced by our behaviors, by our environment, our communities, and the systems that support us. In other words, preventing hypertension doesn't begin after someone suffers a stroke. It begins years earlier through healthy lifestyle, early detection, regular follow-up, and continuous care. And this is the philosophy behind the Healthy Hearts program, and it is the philosophy behind Proteksyon para sa Altapresyon. And this leads us to perhaps the most important shift in public health. So if our understanding of health has changed, then our health system must change as well. For many years, health systems around the world have focused primarily on treating illnesses after it occurs. But for chronic conditions like hypertension, that approach is not simply enough. We need health systems that keep people healthy, not just treat them when they become sick. That means investing in prevention, strengthening primary health care, empowering our barangay health workers, ensuring uninterrupted access to quality medicines, and partnering with communities. And this shift from a sick system to a true health system is exactly what the Proteksyon para sa Altapresyon initiative represents. So as a conclusion, please allow us to share 3 simple messages. First, hypertension remains the leading risk factor for death and disability. And unless we improve its detection, treatment, and control, we will not achieve our SDG goals. Second, we already know what works. The Healthy Hearts program has shown that strong primary health care can dramatically improve blood pressure control and save lives. And third, today is about turning evidence into reality. By launching Proteksyon para sa Altapresyon, Cebu province is not starting from scratch. This initiative can be a very good opportunity for strengthening UHC in the province through strengthened NCD prevention, promotion, and care for people with and at risk for chronic conditions. It is building on proven global evidence, successful Philippines experience, and the commitment of its health workforce and leader. And in closing, please allow us to share the words of our WHO Director General, Dr. 𝗟𝗂𝗏𝗏𝗀𝗇𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 hypertension control programs remain neglected, under-prioritized, and vastly underfunded. Strengthening hypertension control must be part of every country's journey towards universal health coverage. And today, Cebu province is demonstrating exactly what that journey looks like. So daghan kaayong salamat sa tanan and maayong buntag.
Okay, thank you very much, Mr. Santos. Indeed, the global situation provides a more clear perspective.
That is right. As well, this program launching is made extra special, Zagno, with the presence of honored guests who we can see are champions and advocates of health and wellness. In their advocacy, they are always highlighting the importance on the early prevention of hypertension. So, to present the overview and give us a clear picture of the Proteksyon para sa Altapresyon program,
Please welcome the Supervising Health Program Officer of the Department of Health, Disease Prevention and Control Bureau, Ms. 𝗟𝗂𝗁𝗃. A round of applause, please.
Magandang umaga po sa inyong lahat. Pasensya na po, alam nyo, kinakabahan ako na baka ako ubuhin. Atakihin ng matinding ubo. Dahil po this weekend, I had this allergic attack. And mabuti naman po nakapag-consult ako sa aking doctor. Pero meron pa rin po. Kaya pagka nahanginan ako na biglang pag inubo dire-diretso. Sana naman po hindi. Pasensya na po in advance. Okay, so first of all, my warm greetings to everyone present in this important gathering. Hindi ko na po kayo isa-isahin dahil na-mention na po kayo ng ating mga previous speakers. Good morning po and mabuhay to all of us. Of course, special greetings to my director from the Central Office, Disease Prevention and Control Bureau, Dr. Adriano Subaan. Good morning, sir. And of course, to Dr. 𝗣𝗿𝗁𝗃 from the DOH Central Visayas. Good morning, sir. And to everyone po, all the distinguished speakers and guests, and to everyone here, colleagues in public health, in the partners in the NCD Prevention and Control, magandang umaga po ulit. Okay. So, I am happy to join you today in this launching of Proteksyon para sa Altapresyon here in Cebu. My task is to present the overview of the Proteksyon para sa Altapresyon, the Philippine Hypertension Prevention and Control Initiative. Okay. So, next slide, please. First slide. Okay, so this is the picture of our silent killer, hypertension. This slide tells us that hypertension is a silent killer, as mentioned by our previous speakers. Hypertension is a condition of having a high blood pressure that is equal to or more than 140/90 millimeter of mercury. It's a silent killer because it typically produces no warning, no signs or symptoms, yet it slowly causes irreversible damage to the cardiovascular system, leading to sudden heart attack, stroke, or kidney failure. These are the complications of hypertension if not treated or controlled, which we don't like to happen, no? Dahil napakahirap po na to suffer from these complications. Why? Because we become a burden to ourselves. Why? We cannot anymore work as before, no? As we used to work before. we will not be anymore as productive as before na wala pa yung mga complications. We cannot anymore do things that we used to do. So marami ng limitasyon. We become also a burden to our family, no? Siyempre, lalo na kung breadwinner ka, paano na ang support sa family, sa pagpapaaral ng mga anak? We become a burden also to the society, to the government, because of additional cost to your health care. So, we don't like this to happen to us. Meron bang may gusto na to be a burden to anybody? We don't like to feel helpless, di po ba? But rather, we want to be an asset to our family, to the company where we work, to our society, the country. We want to contribute, no, to national growth and development. So, we need to really do something to control hypertension and prevent its complications. So next slide, please. So, with the complications of uncontrolled hypertension cited, we would like to scale up hypertension control in the Philippines from healthy hearts to proteksyon para sa altapresyon. Okay. Next slide, please. So the Healthy Hearts program was localized. Healthy Hearts program localized the WHO Hearts technical package. No? As mentioned by Raj, the WHO developed these hearts, no? A technical package, and Healthy Hearts program is the local version of this hearts technical package. Okay, next, please. The overall objective of the Healthy Hearts program is to reduce premature mortality due to cardiovascular diseases through the scale-up and sustainability of the technical package on hypertension control. Next, please. The main strategies are strengthening stewardship and governance, improving supply and health workers' capacity, generating demand for services in the community. Next, please. So these are the Healthy Hearts technical package consisting of child aids, mga IEC materials, mga hypertension management protocol, and then the e-learning course before, and then of course the e-registry, no, through iClinics, wherein the hypertension registry is included, no, integrated in the